I serve on the Pew Health Commission. That's spelled P-E-W, and it's a commission that has a great deal of power in Washington, and many of the individuals who serve on that committee are leaders, President of Blue Cross Blue Shield, the President of Health Insurance of America, and so forth. And constantly at those meetings, the problems of medicine, the problems of medical education, the problems of medical practice, the problems of over-specialization of medicine are emphasized. And when we look at the dental profession, even amongst the commissioners, the constant statement is dentistry has set a great example. They're primarily a generalist profession. Patients enter through the generalist. The patient is then referred to a specialist, and the ratio is about 80% generalist to 20% specialist, the opposite of medicine. And the entry level for patients so often in medicine is at the specialist area, which is the highest fee area and the highest cost area to the patient. And so the emphasis on the reform, of course, is primary care. Well, of course, American dentistry has already set that example. The other primary push is for prevention and for individuals to take responsibility for themselves on their health care. And dentistry's done that very well. You know, if you look at the statistics, we've reduced the cost of dental care to the public remarkably by our prevention programs. And it's in the billions of dollars. Over a decade, we have saved the American people something like $52 billion in dental care that they didn't have to have because of our prevention programs. They didn't need the denture, they didn't need the partial. In fact is, you know, of the working population today, only 4% have lost all their teeth anymore. And that's a significant move from when it was 30%, 40%, and then 20, and then 19%. And 50% of our children don't have dental decay anymore, at least up to about 12 years of age. So we set a great example, and but there are some problems in that in healthcare reform, the American public forgets dentistry and forgets dental education. And on all the bills that I see, and all of the proposals that come before the Pew Commission, medical education is funded, medical physicians' residency programs are funded, and constantly dentistry's left out. And there has to be a voice for dentistry. There has to be voices for dentistry. We have to take this younger generation of dentists who are graduating, and we have to instill in them not only be there on time and be involved and have a high sense of integrity, but we need to instill in them that they're going to make a difference, and they're going to get involved in their communities, and they're going to get involved with their legislators. And because if we lose the strength of a great profession, we have hurt the American public, and we can't allow that to happen.
Right. The talk was on a national level that not a good time to get into dentistry, not a good time to start studying, because kind of at a low ebb, and there really wasn't a great future. But now, in listening to you, I'd like some of your thoughts on this, because I know you're some good ones. Your thoughts for the future of dentistry right now, you think are tremendous at this particular time, and why you're thinking that way.
Well, in my opinion, it's never been better. And it's never been better because of all of the aspects of the profession. In science and technology, we've moved beyond the simple restorative procedures. The dentist is highly trained in oral medicine, in oral pathology, in diagnosis, in working and consulting with physicians. And as the public ages and moves on into the 90s and the 100 years of age, people living that long with all of their teeth, it involves a professional that will work more intimately with medicine and have a greater knowledge of internal medicine, have a greater knowledge of physical diagnosis. So with the the advances in science and the advancement in technology such as implants and the laser and sealants and new dental materials, it's expanded the role of what a dentist can do. And besides that area, if you look at some interesting statistics, in World War II, when the veterans came back from the war, they came back and they produced 80 million children. Those 80 million children today are 40 to 50 years of age. They are on the peak earning capacity of their life. The veterans of World War II are anywhere from 65 to 75 years of age, and those individuals have control of about $10 trillion. They have, different than the baby boomers, they save their money, they spend it very carefully. The baby boomers want everything now. They want a home now, and they're having difficulty buying because they're a lot more expensive, but they want it now. And they don't want it when they're 70, they want it now. They're willing to go into mortgage, they're willing to spend the money. They want to look good and they want to feel good. And so when you look at all those statistics, as the veterans of World War II die, they are going to dump $10 trillion back into the baby boomers because they're going to leave it to them. So they've got the resources to afford the care. They want the care. They want to look better. They want to feel good. And dentistry can do all those things. So you also look at another aspect is that the number of dentists to population is decreasing. We reached the high in about 1987, 86 of 56 dentists per 100,000. It now is going to drop every year for the next 20 to 30 years. It ultimately, in about 2020, will be 45 dentists per 100,000. So there already is becoming a great demand for dental care. The public is increasing, the population's increasing rather, the knowledge of the public's appreciation for dentistry is increasing. So you've got all of these factors proving that dentistry has a marvelous future. The young people have found that out because in the last 3 years, the applications to dental schools have increased by close to 10% a year. In my own dental school, we have 1,700 applicants for approximately 130 positions. So there's a lot of young men and women who decided dentistry has a great future and they want to be part of it. So not only from the economic side, the science and technology side, but the ability to serve people, to take care of people. And that's what a profession's all about. Right. You get the rare privilege of taking care of someone else and giving them a better quality of life. So as I look ahead, I think this is a great time to be a dentist, and the opportunities are better than ever. The rewards and the satisfaction of being a dentist, there's more rewards now to be gained from giving a patient a beautiful smile, from giving a patient a healthier mouth, from adding to the quality of their lives. So I'm a drummer for the profession.
You're an optimist.
I'm an optimist.
That's good.
The glass is always
half full.
half full to me.
It's not half empty.
It's never half empty.
Well, which leads us right back to what we've talked about. There's no more important time than those to get involved, to work for their profession and to protect their profession and do what they can in this new healthcare reform to give us the best possible benefits to give our patients, or get the benefits for our patients, because as you say, medicine, for some reason or other, I guess because it's life-threatening, I guess it gets more attention than they don't consider our work life-threatening. We can always take care of these things. You know, you've had them come in your office. Oh, you can take care of that, doctor, you know.
Well, Bill, I was sitting on the airplane coming out here for this experience with you, and I was sitting next to a president of a computer company. And it's interesting because he was a very animated individual, very enthusiastic about what he was doing, and he travels back and forth into Silicon Valley in California from his Kansas City company. And when he found out I was a dentist, He went on to say that when he was in graduate school getting his PhD at the University of Washington, he had a fantastic dentist. And all the goal work that was done some 30 years ago, he still had, and that the dentist had warned him then that one of his molars would someday create a problem for him, and he said, sure enough it did, and I needed to have a root canal. And he said, I woke up in the middle of the night with excruciating pain. And he said, you can't believe how bad a dental pain can be. And I said, well, yes, I do understand that. And he said, and the dentist took care of me so wonderfully and relieved that pain. And of course, he showed the fact that he had an appreciation for dentistry, but I wanted to take him one step farther. So I said to him, I said, well, now think very carefully. Have you ever seen an obituary in which anybody has ever said, leave money to dentistry? And he said, no. And I said, you won't even see a dentist obituary that says leave money to dentistry. It'll say leave money to the Heart Institute, leave money to the Cancer Center, leave money to the local hospital, leave money to the children's home, or what have you. And I said to him, now you show an appreciation for dentistry, and obviously you're affluent, and I want to challenge you to support dentistry and dental education. He said, well, how can I do that? And I said, well, you could form an endowment. You could endow a research facility in a dental school. You could endow a professorship in a dental school. You could put a dental school in your will for 10%. Now, I said, of your estate. I said, have you ever heard of an industrialist that's ever done that? I said, I have. So it ties into exactly what you said, Bill, is that because it's not life-threatening, not many people realize the importance of dentistry, but dentistry's education is extremely vulnerable. The state resources are decreasing, so less money is being put into state institutions. 6 private dental schools have closed. University presidents have made a decision to close them. And these are serious times. And education needs the support. Both public and private dental education needs the support not only of every one of its graduates and every one of its practitioners out there, but also needs the support of the American public.
True.
And we need to do those things.
Did you happen to give this gentleman your card as you were parting?
Of course I did. I gave him my card, and I made sure he gave me his.
You betcha.
And tomorrow morning he will get a personal letter from me.
There you are.
With an invitation to come to the university to see a modern dental school.
Yeah.
And I might tell you one of my experiences with Hewlett-Packard. I met with the major, the president of Hewlett-Packard Foundation. And they give $30 or $40 million a year away. They have given at least $100 million to Stanford University. Well, I went to meet excuse me, I went to meet with this individual who is in charge of giving this money away each year, and because his dentist asked him to meet with me. Well, I could tell halfway through the lunch meeting he could care less about dentistry and wasn't interested. I could tell by his body language and his eyes. And so I finally reached across the table and I grabbed him by the wrist, and I just pulled him gently towards me, and I looked him straight in the eye, and I said, Doctor, he has a PhD, and I said, Doctor, you're not really interested in what I have to say. And he was kind of startled by that, and I said, and it seems to me you're really not interested in helping dental research or dental education. He said, that's right. He said, yeah, we're interested in computer science and we're interested in engineering. And I said, well, you're an intelligent man. You've been educated in all the sciences. And why wouldn't you think that the science of dentistry will need your support? And there's lots of engineering and lots of computer sciences involved in the dental profession. And I said, have you ever been to a dental school? He said, no. And I said, well, would you come up and see one? He said, yes. And I said, tomorrow? And he said, well, maybe. And I said, how about 3 o'clock? And he said, well, no, I'll call you. And I said, when will you call me? And he said, well, I'll call you Monday morning. I said, what time? And so I said, I'll be available. So when he called, he came up to the dental school, and the interesting part about it was that he spent 3 hours there. When he got through, his eyes were that wide, and he said, my God, I didn't realize that a dental school is like this. 222,000 square feet, science laboratories, animal quarters, basic science research, clinical science research, patient care. And he said, this is Hewlett-Packard at its best. People intensive, people caring, clean and neat and well organized. We will help you. And that started a relationship between the University of Pacific and Hewlett-Packard, where they've provided us with equipment and computers and medical equipment that we use in our surgeries and so forth. And it's an example of the fact that we have to sensitize people to the importance of dentistry, the greatness of our profession. And so often we don't do that, and we don't do that very well.
It startles me every once in a while that you run into a person, oh, you're a dentist. Do you have to go to school? What kind of education do you have? And by the time you get through, you do all that to be a dentist? Oh, I didn't know that, you know. And they have to be educated.
That's right.
And you're a good educator.
That's right.
You're a good educator. This is a quote from Charles Kettering. Where there is an open mind, there will always be a frontier. He said, my interest is in the future because I'm going to spend the rest of my life there. And I think, just from listening to you and reading about you, I think that's one of your philosophies, that you're going to be spending the rest of your life in the future. And you're quite concerned about it, not so much about the past, but now and what's happening. And just in dental education, compared to 20 years ago when you became dean, almost, what do you look for in the future? What do you look for at your university, at your school, that you're planning for the future?
Well, you know, you have to understand the past to build for the future, and I think it's important to understand the past, but I don't think we should live in the past.
True.
And so education's being challenged, as I mentioned earlier, economically because of diminished support. But it's still exciting, and the challenges, in my mind, are just opportunities, and they're opportunities for education. And here's the challenges for both private and public education are how to attract the best and brightest students, and to be able to encourage them to come into dentistry just as much as they want to go into medicine and computer science and to the business world. So we have a job in order to go after the best and the brightest. We also have another major challenge, and that is an aging faculty that needs to, that either needs to be replaced by younger individuals, or a faculty that needs to be brought into the 21st century. Technology is moving so quickly, science is moving so quickly, the information highway is moving so quickly, that we have a major challenge to keep our faculty on the cutting edge. As I said, that's an opportunity. So at Pacific, what we've done is we have now sponsored 2 groups of our faculty to receive masters in education. So we now have over 40 members of our faculty, approximately 45, who all have masters in education. 30 of them just received them this May. And that's to keep them on the cutting edge. Faculty development programs to keep them on the cutting edge. How to bring new technology and new science in and yet keep the old and not continue to increase the cost of education. So another big challenge for all educators is the cost of education. The average debt of a student graduating from dental school is $64,000 debt now. And that's even higher than graduating from medical school, which is about $59,000. So it's a large debt increase that dental students are experiencing. So these are some of the challenges, and we need to look at those challenges and begin to react to them. Some schools are considering moving to 5-year curriculums. In my own personal biased view, I believe that's a mistake. I believe we need to look at how we can do the job better and how we can provide information in a new way, different than we've ever done it before. Instill into the students a desire for lifelong learning. When we graduate a dental student, at very best, they are safe beginners. If we do not inculcate into their hearts and souls the desire for learning, the desire for being better than they ever thought they could be, we have failed. And so we need to to educate differently than we've ever educated before. We need to motivate better than we've ever motivated before, because a professional person should be a continuous student. And every 5 years, the turnover of knowledge is almost 100%. And if we don't, if an individual as a practitioner does not avail themselves of continuing education and constant learning, then they will be incompetent. And so we have to provide that environment in the dental schools today. Then we have aging facilities, facilities that are growing old, need to be modernized. Funds have to be raised to replace those facilities. You know, an electron scanning electron microscope will cost $100,000 or more, and yet that's very important. Basic science research is being compromised by the lack of funding from the national level and various other levels, and yet the research that dentistry has done in fluorides and sealants and new materials and in new techniques such as surgical orthodontics, such as implants and so forth, have significantly increased the lifespan of the individual, added to their lifespan, added to their comfort, their beauty, their looks, their nutrition. So all of those aspects need to be funded. So there's a great need for dental schools to have funding to carry on their research activities. So those are some of the challenges that I can think about that are confronting education, but again, I look at them as opportunities. In my own institution, as an example, we take the point of view that we are going to help ourselves, that we are not going to wait for somebody else to do it for us. If someone else is going to help us, that's wonderful, but we are going to take the initiative to do it for ourselves. And with that attitude and that sense of family, and people in my institution who give at the 125% level, they're not working at the 75% level, they're working at the 125% level. And with that kind of attitude, I mean, you can break down mountains, you can climb mountains. And I'm very proud of what we've been able to do. The average clinic income that adds to the stability of a dental school is about 16%. In my institution, we're well on our way to 30% of our budget now comes from our clinical management systems. And we're trying to break down the barriers so people with managed care and healthcare reform coming down as a steamroller, we need to provide in the dental schools care for our patients that is high quality, but is delivered quickly and efficiently.
Do you see any great change in the clinical aspect of a dentist? You know, like a lot of people say, the dentist is going to be delegating all this to auxiliary and ancillary personnel in the 2000, that's the magic year.
Well, again, I think we're going to be challenged to change, and we're going to be, our status quo is going to be challenged, and we're going to be a little bit uncomfortable, but I think that with our auxiliaries, our allied health professionals, they are demanding more empowerment. They are demanding and want more responsibility and more training. And they want to be more valuable members of the dental team. So yes, I agree that what's going to happen over time is that the dentist will use the auxiliary to a higher level than they've ever used them before. They'll be trained better. And the dentist will want them trained better. And the dentist will use them more in nutrition counseling and smoking cessation programs, in fluoride treatments and preventive programs. So to some extent, some members of the profession disagree with me in this area, but again, I believe that, that the auxiliaries will assume a greater and greater role in the profession. They'll provided greater responsibility. They will do much more than they have done in the past. They want to do more. They'll be recognized for their skill and their talent and their education. And with healthcare reform, you see the great emphasis of healthcare reform is on primary care and to provide more opportunity for the nurse practitioner and the physician assistants to do more. And as that opens up, and will open up, and as the barriers, the licensing barriers are reduced on the medical side, and the care level provided by the physician assistant and the nurse assistant moves up, and as they do more, I believe you'll see the dental hygienist doing more than they have done in the past. The dentist should always maintain diagnosis, treatment planning. As an example, I hurt my rotor, all right? I had to go to my orthopedic surgeon. He said, my God, Art, you've lost 90% use of your rotor. He diagnosed it. He sent me to a physical therapist. I went to the physical therapist. I came back to see him. He said, wow, you've got now 65% use of your arm. Terrific. Prescribed more, diagnosed more. I went back to the physical therapist. I now have 95% use of my arm. I begin to see that ultimately the dental hygienist will be sitting there in a more active role than the dental hygienist currently has in the profession. And I know that the profession is very concerned about that, but I really believe that the future will change, and that the dental hygienists will be practicing more independently than they have in the past, similar to what's happening in Colorado. There'll still be many hygienists who will never want to leave the confines of the dental team. And certainly that's the best environment, and I agree with that. But the world's changing. Yeah. The thing we don't want to compromise, of course, ever, is the standard of care and the quality of care and the training and education. And we have to maintain that, but it can be maintained. All of the programs show that training programs in the 60s and 70s showed that allied health professionals could be trained in very specific areas to carry out high quality work. And I think that that day will come again, and that there will be more opportunity, and the dentist in that way will be able to provide more care to more people. My own specialty of orthodontics is one of the prime examples of that. We have been the beneficiaries of expanded technology and expanded science in orthodontics, in addition to the more intense use of allied health professionals. And what has happened, when I first started in orthodontics, I could only treat 50 patients a year. When I left orthodontic practice, I was able to treat 5 times that number to a very high level of quality. My son now, who runs the same practice, is able to treat another 5 times more. So he's treating 10 times more patients than I treated originally. And a lot of that is due to newer materials, new science and technology, but the greater use of allied health professionals to enhance the care. And as a consequence, he's also been able to control the fee increases. So the fee increases over time have been less than the cost of living. And so all of that makes for a care that's more affordable and higher quality care and better care. But we can't compromise the quality.
No, these people have to have their education. They just can't come in off the street and say, hey. So there it comes back to the educators again, to develop the programs and to get the people competent to take care of these things.
Bill, one of the areas I forgot about, that one of the greatest challenges to education is one that will benefit the profession. We have a profession out there that's practicing daily, wants to be better, wants to know more. The dental schools need to provide an avenue for better training and skill enhancements for the practicing profession. The practitioner who wants to learn more about advanced perio and tissue regeneration, the practitioner who wants to know more about orthodontics, wants to do more root canal therapy, etc. The dental schools have to be able to step out into the community, provide hands-on programs, bring individuals into the community, into the dental school, a day a month, with their patients, and show them, now, here's how you can do more perio and why. Now, this will put at war, to some extent, between the generalist and the specialist. But in my mind, having practiced 2 specialties, the specialist has to realize their world is changing also. The generalist is being trained better, will do more areas, will do more procedures in the specialty areas. But they will refer more, they will recognize more. And the specialist has to, like in my own specialty, and I remind the orthodontist in some of my presentations, that they have to look at themselves as the neurosurgeons. They are no longer going to do those simple cases, because those simple cases are going to be done by general practitioners. And we have to help them do it to the appropriate highest standard. A specialist must continue to teach and must continue to teach generalists to do better, not condemn them, not criticize them because they've extended perhaps their level of skill a little bit beyond what they should. What the specialist should do is say, let me help you. Here's how you should have done that root canal. Here's the best way to do it, and I want to help you accomplish that goal. So that's a challenge for education. I wrote a paper 34 years ago on the role of continuing education and the fact that the dental profession, the dental educational part of our profession, must reach out and do far more hands-on continuing education. Pankey Mann Institute is an example of having done that. And that's outside of dental schools.
Yes.
And you have institutes that have formed to do that. That should have remained in the dental schools of this country, where pre-testing, post-testing could have been controlled. But dentistry abdicated its role in continuing education and gave it away. And I think they've got to recapture it, personally.
I would envision seeing a department at University of Pacific that will be designated the generals coming in, spending a day, 2 days, 3 days, or a week working with faculty.
We already have them.
You already have them. See?
We have them. We call them mini residencies.
Mini residencies.
And we bring people in.
Okay, so you're way ahead.
They're in there for a year, and they come in 1 day a month or 2 days a month.
Yeah, that's great. That's great. If that was available every place, I would, and people would take advantage of it.
That's right.
That's another thing.
Individuals want to learn.
How would you mold an individual to become a leader in the year 2020? Not just a dental leader, but perhaps a politician, a college professor, a CEO of some major corporation. How would you do that?
Well, I think it starts with listening. It starts with communication. It starts with making young people realize that there's marvelous opportunities for them in the leadership role. And they need to understand that if they develop a high sense of discipline, of integrity, of principles and values, that the whole world, they can conquer the whole world. And they've got to be disciplined. So many people, so many individuals are not disciplined. They will not set goals for themselves. They will not look at long-range plans to reach their destination. But it's all reachable. And I think that the role of educators and senior individuals is to inspire people, to motivate people, to listen to them, but to motivate them. As an example, what I personally do now is that each year where I see an outstanding dental student ready for graduation, I call them into my office and I tell them, you are uniquely talented. You have great gifts. You have marvelous skills, interpersonal skills, communication skills. You're bright, you're intelligent, you're technically very talented. What are you going to do with your life? And their goals sometimes are very meager. Well, I'm going to go out in private practice. Well, private practice is wonderful, but have you ever thought that you could be the president of a university someday? And they sit there and say, who, me? And I say, yes, you could be the president of a university someday. What do you think of that as a goal? Well, I never really thought about it. I thought I might teach at the dental school. Well, I said, start out by deciding you're going to be the president of the university. And over time, you'll get to be the professor, an assistant dean, an associate dean, the dean, and ultimately the president of the university, or whatever. Dentistry opens up many opportunities, as you know. Casey Stengel became manager of the New York Yankees. Right. He was a dentist. The president of the largest dentist insurance company in the world is a dentist. Dr. Eric Olson is president of Delta Dental, which does $2 billion in dental care a year. They're dentists in the Congress of the United States. They're dentists who are CEOs at Aetna, at various other areas, so that you can use your educational degree to move on to many other areas. I think that it's a real challenge to inspire young people, but what they need to do is realize that it's in their hands, and if they've got the talent and determination. And I try to remind them, don't prostitute yourself. Don't sell your integrity down the river. Don't do those things that will compromise your name, your person, your integrity, and who you are, because you'll live to regret it. And there's always difficult. It's hard to make the right decisions many times. You know, it's much easier to take the easier road. But if you start out, as an example I said to students, if you start out in the dental school and you cheat or steal, and you may not think it's very much, it might just be a burr from your classmate. But then when you go into practice, it'll be okay to cheat the public by not doing the highest quality of care you can do. Be okay to have a fraudulent form to an insurance company, and so forth and so on, because you will have compromised your principles, and then it'll become easier and easier to compromise.
Each step.
And don't do that. And we see that in some of our politicians today. They've unfortunately compromised their principles and their own integrity. And I'm sure that if they could look back and change what they did in the earlier years of their life, they might have done things differently, having achieved the position they have today. And I try to remember young people, there is a future out there, and live life and treat people as you would want to be treated.
I think that's very good. And I think on that note, we'll probably end this conversation, Art. And I want to thank you for taking time out of your very, very, very busy schedule.
Thank you very much.
To come here and carry on this little conversation.
Well, thank you.